When we think about heart disease, conditions like heart attacks, blocked arteries, or high blood pressure often come to mind. But today, we are turning our attention to a heart condition that affects millions of people across the world, yet remains widely underdiagnosed and often misunderstood. It's called Hypertrophic Cardiomyopathy or HCM. But left undiagnosed, HCM can have serious consequences. Welcome to Know HCM, a special edition of ET Now. And to help us understand this condition better, I am joined today by an esteemed panel of India's leading cardiologists. Joining us today are Padma Bhushan Dr. T.S. Clare, Chairman and HOD BLK Max Heart and Vascular Institute, New Delhi, and Chairman Pan Max Electrophysiology. Next, we have Dr. Ashwini Mehta, Senior Cardiologist, Professor, Director, Heart Failure Program, Sir Gangaram Hospital, New Delhi. Dr. Viveka Kumar, Chairman, Cardiology, Max Super Speciality Hospital, Saket, New Delhi. And Padma Shri Professor Dr. Upendra Kaul, Chairman and Dean Academics and Research, Batra Hospital and Medical Research Center, New Delhi, and also Director, Gauri Kaul Foundation. Doctors, thank you so much for joining us today. We are talking about this condition, hypertrophic cardiomyopathy. I want you to help our audience understand what exactly it is.
Right. Hypertrophic cardiomyopathy is a disease of the heart muscle. Cardiomyopathy means the muscle is diseased. Cardiac means heart muscle is diseased. It's not a disease of blockages. It's a genetic disease.
Right.
In this disease, what happens, the left ventricle becomes thick. Normal thickness, for example, is around 1.5 centimeters. But in this disease, it can become 2.5, even up to 3, or even up to more than 3. The particularly thickness is more common in the upper part of the septum.
Okay.
When it's the upper part of the septum, and when the blood has to flow, it can cause obstruction. So this is primarily disease of the left ventricle. Right ventricle is less involved and is involved even in a later stage of the disease. And it's not an uncommon disease. It's like 1 in 500, and people need to be aware of this disease because this disease kills young people.
Dr. Mehta, from something that Dr. Clare said, that it's not an uncommon condition. So where do you think is really the gap in awareness?
This is a very critical part of this discussion today. Now, why I say so? Because despite being so common, it's one of the most common inherited heart disease. And when I say that, we have a whole spectrum of patients. On one hand, we have patients who have no symptoms at all. And even if they have symptoms, these symptoms are very subtle. Like they might be having exertional breathlessness or maybe a little bit of dizziness attributed to something else like hypertension, maybe asthma, or something like obesity. In day-to-day life, people just carry on. And on the other hand, people who are very symptomatic, it can really mimic heart disease. How? Because if they walk, they might get chest pain. And yeah, this is the very common thing. And even that's not alone. Some of them, when the disease gets, burnt out, they can have heart failure. The biggest challenge of this disease is a sudden cardiac death. And in many young athletes, it would announce itself as a sudden cardiac death. So you have a whole spectrum, but mind you, it's just like an iceberg. You see a huge thing which is not seen, and you just see the tip. A very few patients who are symptomatic, and many of them you really brushed under the carpet as something else.
Yeah. So, Dr. Kumar, something that Dr. Mehta said, that it is a genetic condition. Would you like to elaborate on that really?
There are 20,000 odd genes in our body, and that will decide how we look like, will be our height, weight, and the intellectual thing as well. So it is like in some patients it can be transmitted like autosomal dominant, where 50% of the offsprings, like children, will have this disease. And this is more common in people who have both the parents are having the heart disease like hypertrophic cardiomyopathy. Then it is much more strongly, it goes into the children. So it is something where the genes will determine, and that is why when we classify that who is at the highest risk, as Dr. Mehta and Dr. Claire said, that the most devastating presentation of this disease is sudden cardiac death. Like within 1 hour of the onset of symptom, the patient is no more. So that is more common in people who have got not only familial history of hypertrophic cardiomyopathy, but also family history of sudden cardiac death. So they are at the highest risk of. So this is something which goes in family. So whenever we see one person have got hypertrophic cardiomyopathy, which suggests the family that all this, sibling of the person or the children should be screened for hypertrophic cardiomyopathy. Since the symptoms and recognition is very important, so we need to be very, very education about this disease, and the potential lethality of this disease should be told to the family and the society at large, so that more and more people are diagnosed early.
Dr. Kaul, my next question to you is that there are, as I understand, two types of HCM. One is the obstructive one and the non-obstructive one. If you could explain it to our viewers.
Well, as has already been elaborated, hypertrophic cardiomyopathy means that the muscle is thick, the cells are bigger, and the contents of the cell are larger. So it makes the muscle thick. Now, when the muscle is thick, the cavity becomes small, as Dr. Claire also mentioned. There are two varieties. One is in which when the heart contracts, the blood flows into the aorta or the main blood vessel freely. But in some, there's an obstruction. That means there's a resistance for the blood to go into the aorta. And that resistance is of different degrees. In fact, that's called hypertrophic obstructive cardiomyopathy. Actually, hypertrophic obstructive cardiomyopathy is more common than non-obstructive cardiomyopathy. About 70 to 75% of hypertrophic cardiomyopathies have some obstruction, and sometimes that obstruction is not present when you do a simple testing. You have to provoke them, like exercise, standing up, or some measures like straining at stools. So you can get that gradient. So that's obstructive cardiomyopathy. Now, obstructive cardiomyopathy is associated with more symptoms. More of the symptoms which my friends were telling you, shortness of breath, chest pain, dizziness, because the blood does not reach the brain in the adequate quantity, and that makes them feel dizzy, and some of them have syncope. Syncope means they fall down unconscious, and in extreme cases, a sudden death is there. So it's very important to know which one is obstructive and which is non-obstructive. And simple investigations like echocardiography, there are various methods, various calculations to see which is obstructive and which is non-obstructive, because the pressures will be different.
Continuing from there, Dr. Claire, I would like to understand, Dr. Kaul did mention, what living like with HCM feel like. If you could elaborate it further, because these symptoms are quite, like you were mentioning, that overlapping with other conditions. So what exactly a typical...
Right. See, the thing is that hypertrophic cardiomyopathy, as Dr. Ashwini said, there are various grades. Some people don't have obstruction, some people are not that symptomatic, but many people have a lot of symptoms. So the main symptoms are exertional in nature. So when they physically work, or they want to climb stairs, or they want to run. Like I tell you, one of my patients, he had a good job, but his office was on the 3rd floor, and he had to leave this job because there was no lift. Every time he used to go, he will feel restlessness, and even once he fainted while going upstairs. So overall, the symptomatology in these patients is very significant, and they have to downgrade their quality of life. So I think most important thing is people, if they have these symptoms, they should have a cardiac checkup done, number one. Number two, another condition, if somebody young particularly has died in the family, those families should get screening for hypertrophic cardiomyopathy, because Sudden cardiac death in young, this is the most important. Below 35, it is the most important cause of sudden cardiac death in the public all over the world.
That's quite scary. And Dr. Mehta, I would like to understand if this condition remains undiagnosed, what can it turn into?
Yeah, so I would like that everyone should really understand that this is something like what Dr. Claire said, that we need to treat it appropriately. But if we don't, and that's what happens in most of the patients, unfortunately. So how do they come to us? They would come to us with complications. And one of the very common complication is atrial fibrillation. So what exactly happens? Whenever the heart muscles are very thick, the heart rhythm becomes very chaotic and the upper chamber starts to beat at a very fast, irregular pace, and due to which there is a stagnation of blood in the heart, and this atrial fibrillation makes a clot inside the heart which can go up and cause a stroke. And this could be one of the presentation, and sadly many patients would present with that. And this is not just alone. Many patients would present to us later on when they're not really treated with heart failure, whereby the heart pumping has gone so low that the heart fails as a pump, and just a little bit of walking makes them breathless. They have swelling all over the body, the lung is filled with the fluid, and we need to treat it aggressively. Like we have discussed, and the most dangerous thing and the most fatal thing, what Dr. Claire also just said, sudden cardiac death.
See, another thing I want to add here, because it's important. In hypertrophic cardiomyopathy, if you do high intensity exercise, you can develop cardiac arrest. You can develop a rhythm problem from the lower chamber of the heart, which is like a cardiac arrest. Now there have been many instances that a footballer in the field has a cardiac arrest, and there are examples of being saved with the defibrillator. But my advice and request to the public is that if anybody wants to do high intensity exercise, like you want to do a marathon, you want to become a national, international player, at least those people should be screened for hypertrophic cardiomyopathy.
Dr. Kumar, I'll come to you. We've been hearing about symptoms, breathlessness, dizziness. If our audience listening to us right now is experiencing some of these symptoms, what are the 5 symptoms that you'll say if you are experiencing it, please get yourself screened? What would those 5 symptoms be?
Yeah, so I think as we have already discussed that there could be very subtle symptoms and there could be lethal symptoms.
Right.
So subtle symptoms, if we start that as the disease progresses from adolescence, then the person would have difficulty in doing the job which they were able to do before. So they will be unusually breathless, or they would have effort intolerance where they are not able to climb 2 flights of stairs or even 1 story, and then they'll have the problem of chest pain. So there is a demand supply mismatch, because the heart arteries are supposed to supply 50 grams of heart muscle. Now they have to supply 100 grams of heart muscle. So these are demand supply mismatch. And then there is another thing which happens is that there is because the arteries, muscles are thick, they compress the artery during contractile phase in systole. So it also causes chest pain and it decreases the blood supply to the heart muscle. So they will have effort intolerance or breathlessness, then they will have chest pain, and there is a terminology which we call it heart failure with preserved ejection fraction. So what Dr. Ashwini was saying, that the heart in the end stage will become dilated and they will become heart failure with reduced ejection fraction. But upfront in the disease process, they will have heart failure with preserved ejection fraction, where the heart is contracting much more stronger than a normal person. So that is why we say something excess of good is also bad, and that is what exactly is happening here. So the heart is not able to relax properly, and then the patient will have intolerance, as the heart cavity is small because the whole space has been filled with the heart muscle thickness, and then they will have palpitation. So you cannot brush it off, because palpitation is a hallmark of very bad thing, ominous thing coming in the patient's history. So we evaluate that there could be arrhythmia of the top chamber, like chaotic rhythm of the atrium, which is called atrial fibrillation, or it could be, as Dr. Kriya was saying, that it could be chaotic rhythm of the bottom chamber or pumping chamber, which is called ventricular tachycardia, which could be lethal if it is. So we put them on rhythm monitoring devices like Holter and all and see what is going on, and that is indication that if those arrhythmias are there, the patient should be treated with appropriate device and the medication. And then they will have the most lethal presentation would be having that repeated syncopal attack, especially on exercising or stress. As my colleagues were saying, that those who are unscreened going into the high intensity sports, they will have the problem. In fact, in World Cup, there was a player who had a sudden cardiac arrest on the pitch itself, and he was revived, and later on he was put on a device and he had a successful career again. So these are the things which should not be taken lightly, and in our society where the awareness is at the lowest level across the globe, this awareness about this disease, because as we said, the data suggests that it is not very uncommon. So we need to spread that, look, if there is a early death in the family, if there is a unusual breathlessness, if you have the palpitation, and if you get chest pain at young age, because we understand at elderly age there will be heart blockage in the arteries, and the person will have chest pain. But if it is happening at a young age, it means that it is something which we call non-coronary artery disease angina, and this is one of the most prominent cause. So these are the broader, symptoms which should be looked at.
Dr. Kaul, like we spoke about symptoms, I want to understand, once someone goes for testing, consults a doctor, what are the next steps? And what are the diagnosis and treatment options available today?
Well, once the disease is suspected, there are tests, and ECG is one of the first tests which is very frequently abnormal. But some of those changes can be non-specific. Echocardiography, which is widely available, it's available in every town, even in villages these days, is one of the investigations which picks it up very well, because you see the thickness of the muscle, you see the thickness of the separation, that is the septum. You also see by Doppler, that is kind of a sound waves which are coming out, that there is an obstruction. Other very good test, which is not so easily available, but it's available in metropolitan cities, is MRI, cardiac MRI, which gives you even much more information. It can show you the muscle structure, which echocardiography shows to some extent, but you don't see it so well as you can see in an MRI. But then there are some other methods which are non-drug methods, something like to make the septum thinner. It could be surgical. So we have so many methods these days.
Dr. Kaul mentioned so many good points. In India, if somebody dies, like a 30, 25 years old person, in the media everywhere, he had a heart attack. Yeah. He died of heart attack. Yeah. This is totally wrong. Yeah. As I told you before, that the commonest cause of death, sudden death below 35 is hypertrophic cardiomyopathy. Then there are other cardiomyopathies. Means the muscle disease. Where cardiomyopathy means they say disease of the heart muscle, not arteries. So people should be aware of these things, that it's not, everything is not a heart attack.
And very interesting, we've spoken about symptoms, diagnosis, treatment, and some very pertinent points here. On the ending note, I would like all of you to share that, that final hope for people. I mean, even if they, our listeners right now are experiencing these symptoms and want to go for a treatment, a checkup. So what is it that you'd like to say?
See, I say one thing to public in this country, that at least in heart disease, if a patient is and his relations are wise, if they have money, then no patient should die of heart disease. Because I tell you why. Because ultimately, even in hypertrophic cardiomyopathy, sometimes intractable symptoms or a stage of dilated heart and stage heart failure, you can have a heart transplant. It's available in the country. Right. So it's not available, but people should know it's available.
In my mind, what it really needs today, what is the need today, is a need of partnership. Why I say so? Patients, family, and the medical profession. Correct. Awareness. That's the first thing. Don't brush your symptoms just like that. If you have any doubt, reach out to your doctors. And today, with proper treatment, you can prevent. And we have amply highlighted all this today, that how we can prevent.
Yes.
But I think the most important thing is awareness and the partnership. If there is a sudden cardiac death, must look and screen all other people.
Yeah, so I would say, again, taking things forward, that, if we say that awareness of the masses, so programs like this where you educate the society, and also one big takeaway would be that all those people who are trying, or the parents whose children are going into the sports, especially high intensity sports, they should be screened for hypertrophic cardiomyopathy. And it is something which should be, the society should be sensitized.
We should always remember that according to very conservative estimates, 1 in 500 people have hypertrophic cardiomyopathy, and that may be an understatement. So that should be kept in mind when we're talking to the general public, and any smallest suspicion, you should get investigation done. And these are not very expensive investigation. ECG and echo is going to pick up 90% of hypertrophic cardiomyopathy. You should not go back with the idea that a large number of them are going to require defibrillators, alcohol septal ectomy and other things. Many of them, most of them will do good on affordable medicines and some counseling.
Doctors, thank you so much for sharing your expertise and helping us better understand a condition that deserves far greater awareness. One of the biggest takeaways from today's discussion is that hypertrophic cardiomyopathy is not as rare as many people think, but it often goes unrecognized because its symptoms can easily be mistaken for everyday fatigue or stress. If you experience persistent breathlessness, unexplained chest discomfort, dizziness, fainting episodes, or if there's a family history of HCM or unexplained sudden cardiac death, do not ignore these signs. Speak to your doctor and seek the advice of a cardiologist. Thank you for watching No HCM, a heart condition that matters on ET Now.